Substance abuse is being reported by the National Tuberculosis Programme as a common behavior pattern impeding tuberculosis elimination efforts in Ghana. 20 to 30% of patients living with the infectious disease are using illicit drugs, primarily marijuana and cigarettes. According to manager of the National Tuberculosis Programme, Dr. Jitendra Mohanlal, who spoke with Nightly News exclusively on Friday, those cases appear more contagious and difficult to treat.
Drugs, and they have very difficult circumstances, and we have to work with them, continue to work with them. But they can, be very difficult to work with because the treatment is at least 6 months, and for some of them who, with the drug-resistant TB, takes as long as 2 years. So imagine you working with a patient who's a substance abuser or misuse substance, and you have to work with him for 2 years.
Dr. Mohanlal indicated that in order to address such behaviors, the program has been collaborating with civil society organizations to establish support groups.
Yeah, well, that's what we've been working. The program has been working with Phoenix International, Salvation Army, having patient support groups, having persons who complete treatment who was on substance, taking charge of support group. But we had some interruption with that with COVID. But these are things we address, but we would like to take that to another level.
Persons infected with tuberculosis who use illicit drugs are less likely to complete treatment for latent infection or the active disease. Tuberculosis medications are usually metabolized by the liver, which is often damaged by substance abuse. The TB program manager informed that there are also plans to establish a tobacco cessation clinic which will aid persons to quit smoking. Rates of tuberculosis is relatively high among the homeless persons, some of whom also use illicit drugs. To target this aspect of the population, the Ministry of Health will be partnering with the Ministry of Human Services and Social Security to establish a monthly clinic at a night shelter which will provide care to patients at the facility that are living with tuberculosis on April 7th. The incidence rate for tuberculosis as of 2019 is 67 per 100,000. Temika Rodney reporting for the HGP Nightly News.